Hello, I am Dr. Teena Thomas, obstetrician and gynecologist, Bangalore. First, here the question says that the period means that the period was delayed for 2 weeks, then the person got the period. Then after stopping, immediately 15 days later, she again got her period, and this time the period was very painful. Now, first thing here to rule out is a pregnancy, an abnormal pregnancy. With the delayed 2 weeks early delayed period, she would have already been pregnant, and that was just a bleed. So just rule out an abnormal pregnancy. So a beta HCG blood test to be done. If the beta HCG is negative, then just it is not pregnancy, and if it is not pregnancy, it may be a hormonal imbalance. So what happened the last cycle, when there was a delay in 2 weeks period, the actually ovulation did not happen, and when ovulation did not happen, the period got delayed. She had an increased flow, that is what which happens. The flow, watery flow, will be more of blood in an anovulatory cycle. So she would have blood a little more, and then she stopped it and comes back another period probably, and this with little extra bleed and clots and painful periods. So that may be a part of hormonal imbalance. Now if the pregnancy test comes positive, then probably we'll have to rule out miscarriage which has happened, or an ectopic pregnancy, because the worry here is an ectopic pregnancy, an abnormal tubal pregnancy has to be ruled out. If that is there, appropriately treated, serial beta HCGs, ultrasound scan, all needs to be done and followed up and treated. But if there is nothing, just treat her with a painkiller for that period, or a non-hormone tranexamic acids to bring down her bleed and settle her down, and basically watch her next cycle. If the next cycle is regular, back to nothing. If the next cycle continues to be irregular, follow her up and investigate.